Hello everyone, it's Hannah from HLP Therapy. Today we're going to be talking about when you cannot touch your scar. Why will this be and what can you do to help yourself? If this is you, then watch this video and find out more. If you have had any kind of surgical intervention, whether that be C-section, a mastectomy, lumpectomy, thyroid cancer, any kind of surgical intervention, you will be left with a scar. Now, you might be surprised to know that many clients come in to see us in clinic and they cannot touch their scar, and it's been weeks, months, sometimes even years after their surgical operation. And why is this? Well, there are numerous reasons. It could be that the surgery was something that you didn't want and you felt forced into having it done. It might have been a really traumatic birth, so then looking at that scar reminds you of the ordeal that you went through. It might be that it was life-saving treatment, and even though you are glad that the treatment worked, actually the scar that you are left with is a reminder of having to go through that life-saving treatment. It might be that you just don't like the feel of it, as scar tissue is a different dense textile structure than your normal skin, and it feels strange underneath your fingertips. And it might be that you don't like the look, the feel, and also how it impacts your body, how it impacts your movements, what you feel about yourself, the clothes you wear, intimacy with your partner, and so many other factors that can go into you not wanting to touch that part of your body with the scar. But there is good news for you. If you want to start scar therapy, we're going to give you some tips on how you can gently start to do that. And of course, do this in your own time. There is no rush. Don't compare yourself to anyone else who's had the same surgical intervention as you. And take your time in engaging with that scar when you are ready. So some little tips that we tell our lovely clients are, if you have a scar and you can't look at it directly, then get a mirror and look at the scar in the mirror first of all. Once you're comfortable looking at it in a mirror, take your time in doing this. You might want to do that a couple of times a day for a couple of weeks, and then start to look at your scar yourself. It might be that you don't want to directly touch your scar, but you know scar massage would really help. And in this case, what we would say is touch around the scar. Mobilizing the tissues around the scar can still have a great effect on the scar itself. So of course, do sweeping motions around the scar, do circles, move the tissues up and down. Mobilising the tissues around the scar is great to get more circulation, blood flow, heat, and a little more feeling in and around the scar without actually touching the scar itself. You might want to attempt to touch your scar, but have a really thick cream or gel or oil on your fingers to act as a barrier so you're not directly touching the scar itself. Actually, it's the cream or the gel that is touching the scar, and you can move that over the scar to keep it hydrated. All these things are great in terms of engaging with your scar, mobilising the tissues, and help to reconnect with that body part without directly touching the scar itself. Our one final tip is this: if you're in the very early stages of healing and your scar is fully closed over and there's no stitches or staples or infection, what you can do is use a nice soft clean face cloth to pat around the scar, to massage over the scar as well, or a very clean brand new face brush, and you can sweep over the scar to really help you get a bit more feeling and to actually start engaging with that scar. So try these techniques. Comment below on what's worked for you, and if you have any ideas on how to engage with the scar but not directly touching the scar, then please comment below. We would love to hear your thoughts. And of course, we wish you all the best on your recovery journey.